So far we've talked about some cognitive techniques, so challenging thoughts. We've talked a little bit about behaviour, so a behavioural experiment to test out whether actually I could put myself in anxiety-provoking situations and find that nothing bad happens. So we would call that exposure therapy, which is exposing yourself to a situation that may seem anxiety provoking. The one area we haven't sort of spoken about would be the body. So CBT is perhaps the one sort of psychological therapy that doesn't stop at the neck, but actually says our minds and bodies are one unitary whole. So if our body is physiologically in a state of arousal, unnecessarily, so pumping adrenaline around the system when it's not required, that in itself can kind of prolong or promote or even create anxiety in the first place. So some of the other techniques we might be undertaking with a client would be to work with the body. So relaxation techniques, breathing techniques, even visualization techniques to get the body playing ball. So, for instance, if you have an anxiety-provoking thought, but your body is calm, the message comes from the brain, guys, this is dangerous, we must fight or flee. And if the body just says, no thanks, I'm fine, then the brain will not push. It will get acceptable, suitable feedback from the body. CBT is also the NICE approved therapy for depression. In depression, we know that a lot of people will have a neurochemical imbalance in their brain, so they'll be lacking serotonin. And so where CBT starts is again with the body and the behaviour of the client to get the client doing things such that some of the other neurochemicals which are still available to the brain can be brought online so that the client gets the lived experience of feeling a little bit better and learns that they do have some control over their mood, albeit short-lived and possibly a longer battle. So this would be called behavioural activation. So it's encouraging clients to kind of take an oppositional stance to depression and say, even though you don't want me to, or I didn't feel like, I did go for a walk or sort out my sock drawer. Very small tasks that would give a client either a sense of mastery or of pleasure or some form of exercise. So again, using what we understand about the body to help counter a sort of a mental problem such as depression. CBT is recommended for depression and anxiety, and by anxiety that will cover any form in which anxiety turns up. So it could be a simple phobia or a more complicated post-traumatic stress disorder, which is seen as an anxiety disorder. Obsessive-compulsive disorder is actually an anxiety disorder because people feel terribly alarmed and undertake activities to sort of calm the system down. OCD is very interesting, and the techniques in OCD cover everything that we've talked about. So there's a certain amount of mental challenging that if you have a thought, you don't have to go along with it. There's a certain amount of behavioural changing that is required, although the behaviours feel very compulsive. People are compelled to wash their hands or check doors and windows, etc. At the end of the day, you can decide, and even if you feel terrible, you can avoid washing your hands for the 100th time. So there's cognitive and there's behavioural challenges in OCD. OCD is very amenable to CBT. My experience is that it shows very good results, much more rapidly with CBT than with other therapies that are more exploratory in nature. So certain kinds of conditions really benefit from a structured plan which encourages behaviour that will improve the situation, rather than leaving the client left just turning over material in their minds. I'm a great believer in all different kinds of therapy, but it's about finding the right therapy, and possibly, dare I say it, the right therapist for the problem that you have at the time in your life that it it pops up. So I would encourage people to act a little bit like consumers when it comes to obtaining therapeutic help.